Hi, my name is Brian, and today what I wanted to do was talk a little bit about cell-free tumor DNA, or what they also call circulating tumor DNA. The idea is here, which I'm trying to show you, is that there may be some DNA that comes from normal cells, but there could also be some DNA coming from tumor cells. And trying to figure out the difference between the two and how to utilize it has been the challenge. Um, there's an assay that I've been using on like one or two patients now that I was really impressed with that I wanted to tell you about. I get nothing from the company. Um, but I just think it's really cool. And so that's the story I want to tell you. They take a piece of the tumor biopsy or the tumor specimen, and what they do is then analyze it for tumor mutations to create like a profile of the patient's cancer. Then what they do is they collect blood from the patient, and they then analyze that blood for mutations matching what they found in the tumor. So they're not shotgunning it, but it's a very focused approach to see what the cell-free or circulating tumor DNA is within a patient's bloodstream, that they've been able to create a tumor score to kind of figure out what the burden of disease is within the patient. So this is the patient here. He was a very nice gentleman who was in his 50s. And I'm going to detail a little bit of the anatomy and what we were trying to do. This right here, you see, is his bladder. Here's his tumor. And he had a whole bunch of lymph nodes that were all identified based on MRI. And so what we then decided to do was treat him with what we call total neoadjuvant therapy. And I'm going to show you how the dose looked from this radiation treatment. We were trying to give about 50 Gray to the tumor and 45 Gray to the lymph nodes. And we were using arcs. And what you can see is we were targeting all this area in here and also up to there where the top of the lymph nodes were. The dose falls off pretty quickly. So the patient had, by MRI findings, T3C N2B disease. He had two suspicious extra mesorectal lymph nodes. One was, I think, an external iliac, and the other was an obturator. And those were both being covered by my radiation fields. And so he had a blood draw done before treatment began, and he had a score of 17 MTM per milliliters. And MTM is like a measure of the mean tumor molecules, which is they're trying to quantify how much circulating tumor DNA they're finding based on their analysis from the tumor specimen. And he was concerned that they didn't do this right when they were doing the blood draw. So he asked us for a second test done right before he started treatment. And this one showed a very similar value, actually a little bit higher. Now it was up to 19.4 MTM per ml. And then at this point, he started his 5 weeks of radiation therapy, 5.5 weeks. And he finished at the end of September. And so on October 3rd, he had his first post-radiation treatment on. He was given the radiation with concurrent 5FU chemotherapy. The MTM per ml was now down to 0.91. So I thought this was kind of interesting. He then continued on the rest of his chemotherapy as part of his total neoadjuvant treatment. And what we found was that at the end of October, the MTM per ml was now undetectable. And he finished his chemotherapy around Christmas, and he had another blood draw. And again, there was no circulating tumor DNA able to be detected. So he kept asking me many, many, many times what was going on. And he finally got his restaging studies done at the beginning of February. And what we found was by MR, essentially a near complete response. And so the question becomes is like, what does this mean? And I kept trying to tell the patient that what it means is that, we are not seeing any more blood showing any circulating tumor DNA. The DNA is not being shed into the blood anymore. It probably is the better way to be saying this. It didn't mean his cancer was gone, and it didn't mean that he can stop treatment, or at least we can't say that yet. But all we can really say at this point is that there is no more circulating tumor DNA in his blood. What's important here is that we learn how to use this tool to the best benefit of the patients. And there's currently an NRG study that is called Circulate USA, which is looking to try and figure out what the significance of the presence or absence of circulating tumor DNA is in patients like this one who get surgery for colorectal cancer. And it's really important that we do these types of studies to determine how best to use this assay for the benefit of our patients. The future of this is really wide open, and it could be useful in helping to guide therapy in not just patients with colorectal cancer, but patients with lung cancer, patients with head and neck cancer, patients with any esophageal cancer. It'd be phenomenal to use in those settings. Those types of patients are getting neoadjuvant therapy. It's also really important to help us define what oligometastatic disease is and trying to find the best way to put those patients into some type of cured type category. And I think on that note, I just want to say thanks for your time and stay safe.